Welcome to another Wanna Know Wednesday. Cancer has been part of my life for 7 years now, starting with my personal diagnosis when I was 31 and 5 months pregnant. I've had 2 aunts, an uncle, my father, and my grandmother that all go through this experience too. Not to mention countless cancer friends and our family members on happychemo.com like you. Now, over the years, I've heard about some crazy things that people have given to cancer patients, thinking they were being helpful when really not so much. So today for our Wanna Know Wednesday, we're going to talk about a few things you want to avoid giving and perhaps other options you can choose to give instead.
Though I tried not to hurt you, though I tried, but I guess that's why they say every rose has its thorn.
While roses and a fresh bouquet may mean I love you, it can also unfortunately mean funeral. Now, cut flowers die quickly, and while your heart is in the right place, you probably don't want to be the one who brings the reminder of how fleeting life is to a person fighting to stay alive. Case in point, one survivor shared how after coming home from surgery, she found a bunch of dead roses on her front porch. Now, they had been left by a kind-hearted person who just didn't realize that by the time she got home, they would be nothing but dead stems and flower petals. Needless to say, it wasn't a welcome gift. Now, some people also become highly sensitive to plant molds and bacteria during treatment, so it's best to really just avoid them altogether. For the same cost as cut flowers, you can then plant wonderful perennials to put in their flower beds. Now, these rebloom yearly. While you're at it, do some yard work without being asked, and for heaven's sakes, pull some of those weeds. That way, your kindness will be remembered for years to come every time those flowers bloom. It's normal for cancer patients to experience a heightened sense of smell during treatment. It's called hyperosmia, which is an exaggerated or abnormal acute sense of smell. So fragrances that may have once felt absolutely amazing might be really overwhelming and nauseating. Patients talk about even the best smells, like things they used to like cooking meat, can make them sick, or how they can smell chemicals in the cleaning aisle at the grocery from clear across the store. Smelly lotions can have that same effect too. And while we're on the topic of lotions, check the ingredients on back of the bottle. If the lotion contains sulfates, parabens, or petroleum, among others, it's not the best choice for them or for you for that matter. When in doubt, avoid strong fragrances or simply ask what smells good to the person you're buying for before you drop something off. Their nose will thank you. Want to know how to instantly offend a cancer survivor? Give someone who doesn't have breast cancer something covered with pink ribbons. Even though the cancer world seems pink at times, that is only one of the many colors that are associated with different cancer types. So it's smart to avoid cancer ribbon products unless you're absolutely sure you know what ribbon color signifies the cancer they are fighting. And while some people enjoy wearing cancer ribbons as a badge of courage and honor, others can see it as a symbol of their sickness. So make sure you talk with them or one of their caregivers and ask what they prefer. When in doubt, getting a neutral gift that doesn't have ribbons is the safest bet. They might enjoy getting an oversized mug, wishing them an extra boost of comfort, nourishment, or hugs and kisses. You can then feel it with useful hand-picked items like cozy socks, lightweight mittens, lemon drops, and a handmade note. Every time they use it, even after treatment, they'll think of you. And since it's ribbon-free, your kindness will be the welcomed memory, not the cancer experience. Many cancer survivors complain about being cold too, so perhaps you could send them a warm embrace, like a soft and cozy handmade blanket wrapping them in love. Again, ribbon-free, but memory-full. Everyone can use an extra boost of something, so when choosing gifts, make sure that you think before you give. So now it's your turn. What gifts would you love, and what gifts would you like people to avoid giving you? Did you get a gift and think, what were they thinking? What's been your favorite gift ever? Tell us about it in the comments below, and we will be selecting 5 random winners to receive either an oversized mug or a warm embrace blanket provided by an extra boost of.com. I'm Ginger Johnson, founder of happychemo.com, wishing you all the hope, health, and happiness you can handle. We'll see you next time at happychemo.com. Yeah, make sure you don't toot on camera.